Exactly the same as the other two. Do you want to do an introduction and then we'll do some
I'll do an introduction. I mean, obviously, when I was here this time last year, I was saying the biggest challenge ahead of us was the situation with the budget of adult social care. And you'll know from our discussions pretty much a year ago tomorrow, given we're sitting council tax tomorrow, that the big challenge that we had was finding £5.5 million worth of budget savings that were set out in that budget, plus because that budget put in 1.9 million's worth of sort of one-off money, we effectively had to find that money as well during the year, so that we knew that when that money stopped being one-off money, we were in a place where we could roll forward without it into 18-19. So we had that big challenge of trying to find that £7.4 million worth of savings during the year. It's not always been easy, but we have reached that and we've managed to achieve that successfully. In fact, we've gone over, I think we're about 8.7 million worth overall, so it's fairly significant. Now, of course, that's not money we've got to spend because we know the pressures are still there in children's and within the adults and children's department. There's still a call for that money to use, but that has been a significant journey and a significant challenge that we have been able to meet. And I think it's been very important. I mean, we had some great help from the finance department getting us there, but I think the work that's been done within adults and children's to enable us to get us there has been really good, and the work of the senior officers has been excellent on it. But I think what I really want to pay testament to is actually how that's percolated down in terms of the ethos of the department as a whole. And I think the approach you're getting from middle managers and below actually about some of the creative solutions to try and find money about impacting on services has been really effective. So I don't want to go into too much detail about that there now. One of the things that has been alluded to earlier is the mental health and wellbeing strategy. It's a strategy that's took quite a long time to get here. Indeed, I was reflecting on officer that it's taken about, I think, 5 years for us to develop it, but we do have that strategy. It has been agreed by the council, the CCG and the Health and Wellbeing Board. And I think actually that a lot of the time, certainly the last few months, to try and get things right and to get those conversations with the community right were really important to be able to develop that and to get it to a place where it felt as if we weren't just signing a piece of paper because we needed to have a document called a strategy. We actually got to a place where we're having a document that really was driving how we go forward for mental health in the borough and our work with the CCG and ourselves to do it. There are still challenges ahead because obviously it's not the council and the CCG on their own which hold all the cards in this, but I think it's got us to a far better place to work forward from. And as part of that work, and obviously we're now working on the implementation plans to develop that, and we've sort of picked some areas that need to be prioritised first in that. But alongside that, so we've been developing the suicide strategy along with public health, and Kevin's team has been really helpful in putting that together again. The last strategy was agreed in 2005. It's very clear with the situation, sadly, that we have nationally with suicides increasing, and Southwark is no exception to that we need to do something to tackle, to reduce the number of suicides that we have, also reduce attempted suicides and self-harm as well. And so that strategy is something that we'll be considering in March Cabinet. One of the pieces of work that this committee started off was its Time to Care report, looking at residential and nursing care home provision. I think the nursing home part in particular has been a real challenge for us, that we've just had insufficient capacity. So again, in December we've got a strategy which at least gets us forward and helps us develop that strategy from having the sort of number of beds at the moment available to us, which is sort of about 120, to about a capacity of over 300 in the borough. I think gets us to a far better place in terms of capacity that we have in the borough. That's clearly, we've got some interim steps together there because it's going to be 2020 before we are there. But we've had some really exciting, I think, conversations with providers about how that's going to be delivered. So, in particular, Jeanette and I went to see Country Court Care, who had taken over from Four Seasons Burgess Park. And as you know, Four Seasons had a number of really poor inspections, and as a result of that, Burgess Park was closed. Country Court Care want to come in, they want to rebuild the home, and we went to see their home at Milton Keynes, which is on an identical design. We think it may tweak it a little bit, but basically to what they want there. And it was really impressive, and it was one of those times, and this time last year I've been talking to you about extra care and about how the great thing about extra care was it seemed like homes that you could see yourself living in. I thought the same about the Country Court Care place, which I have to say, if I'm being really honest, I wouldn't normally say about nursing care homes. You kind of look at it and think, yeah, actually, you can see people treated with real dignity and respect, that actually it was a really good standard, that the sort of ethos about the approach in terms of how they treated staff and how they looked after places was right. So I thought that was really impressive, and I think that's going to get us to a far better place in terms of nursing home provision. I think our shining beacon, though, in terms of what we do in this borough, in terms of adult social care, has been the Ethical Care Charter. We, in December, agreed how we were going forward with the new contracts in October, for the Ethical Care Charter. £21 million worth of work a year, so a huge amount of what this council does. And the fact that before, these were people often not even working on the living wage a few years back before we started this journey, I think it's shameful when we're looking at people looking at our most vulnerable people in the borough. And I think the real test, or the real demonstration of the Ethical Care Charter has been working in how we've implemented it so far. It's got about 50% of all our home care has been the fact that satisfaction rates have risen from only 53% before we introduced the Ethical Care Charter to a consistent 90% plus over the last 8 quarters. And over the last year, 95% plus in terms of satisfaction. So a huge jump in satisfaction levels, which shows that this is not just about treating the people that work via our contracts for home care with respect. It's actually delivering what it really needs to do, which is a far better service for the people that are receiving our services. So again, that has been really pleasing to see that, and now with the mobilisation of the new contracts, we will be covering the entirety of our home care rather than just about 50%, which was currently previously under contract. We're moving away from the spot purchases, which are covering the other 50%, and bringing in a model which covers the entire borough and ties in with the local care networks as well, which ties in with our work with the Health Authority. Moving on to work with the Health Authority, before I go on to talk about Integrated Planning and Delivery Group, the two Richards committee that Peter alluded to earlier, I do think we've obviously benefited this year from improved Better Care Fund money. It's money which has had big strings attached by government, saying that in exchange for this they want to see far better rates of in terms of avoiding delayed discharge from hospital. We've a target of about 195 delay days per month for the entire system, including hospitals and ourselves as a borough. The good news is, at the moment, up until the end of Q3, and you'll realise that Q4 is actually the difficult quarter, given its winter pressures, but to the end of Q3, we were averaging about 100 days a month. So, a long way short of that 195 target that the government have set us. It's the 4th best rate in London, and certainly one of the best in the country. And whilst I don't want to point my finger at our neighbours, it's interesting that obviously we deal with a number of hospital trusts that deal with one of our near neighbours in pretty much equal numbers, and that borough is about the 6th worst in London. So it's clearly something different that we're doing in Southwark, and I think, having visited the discharge teams, they do a really good piece of work there that's been really effective, and it's clear as well from the data that actually of those 100 days discharged, the vast majority are attributable to the NHS rather than us as a council. In fact, even within the discussions we've had with the NHS about how the balance of where that 195 should fall, we're sort of achieving significantly lower numbers than our target was, even though the NHS still had ongoing pressures. That also ties in with the work that we're doing on reablement as well. I think the joint work that we are doing with Guy's and St Thomas's around that, establishing an integrated reablement team, which is bringing some of the management of that service in-house as well, rather than having external, I think will be really interesting to see how that goes, and I think will give us a far better service for the future. I briefly wanted to touch on learning disabilities, because obviously that has been something which has taken a lot of time and actually attention of this committee and OSC as well. And obviously we've been through the issues around the closure of Queen's Road and the establishment of an expanded service at the Southwark Resource Centre. But there are a few other things I just wanted to mention really in terms of looking at the way forward. I think firstly, I last week signed off a Gateway Zero about residential services for people with learning disabilities. We this odd imbalance at the moment where we've got about 178 people with learning disabilities that have residential placements within the borough, but we've got about 117 that are out of borough, and I'm sure there are some good family reasons for a few of those, but nowhere near 117. I think we need to look again at how we commission our services, because sending them outside the borough isn't saving us any money. In fact, it's a lot more expensive, and it's not the best outcome, even more importantly, for those people in terms of community links. So getting us to a better place in terms of commissioning those services is going to be really important, I think, for the future. And I think it's also worth saying here, we've had some good news in terms of capital projects. We've got the new residential facility at Half Moon Lane that has recently opened. Really great facility for people with learning disabilities there. And I, a couple of weeks ago, visited the new respite service at Orient Street. So Orient Street, where we've long had a respite service, half adults, half children, has been pretty much completely stripped out and rebuilt, and now looks really, really fantastic. Even if the garden did seem a little bit like a Big Brother garden to me, I thought, well, but other than that, it is a really great facility. It's a fantastic place. If you've not been to see it, please do drop in and have a look. Finally, one of the really interesting pieces of work, and again really forward-thinking, has been the work that we've been doing with the CCG on the integrated planning and delivery group. That was a one-year task and finish group, as Peter said. It's coming close to the end of that, but I think it's got us to a far better place in terms of our future work in the CCG. I think not only in terms of the vision of where we go forward, but actually I think it's helped us foster better relationships with the CCG as a whole. It's good for us to be meeting around the table, having discussions about looking to the future, rather than being perhaps overly tied up in some of the transactional toing and froing that I think sometimes there is with the CCG. I think developing a shared vision has been really helpful, and to pick up on Leo's point earlier about doctor surgeries. I think part of the problem we sometimes have with the CCG is it sometimes feels like we almost talk a different language. And I think getting us to some place where we are able to feel as if we're on the same wavelength of things, I think is really important for getting us forward and understanding what the challenges are. And again, I'm happy to talk about that more, but for me, one of the things I said at our meeting last week I think is really important is where we get to in all of this. We're doing work and we'll be picking a few areas about where we can really improve things quickly. We've done some laying of the foundations. But for me, I want us to get to a place where it feels for somebody using health and social care services that there is effectively almost a single service between the two of us. And I think as well it's important we are having a whole population view of people, rather than this is a social services view of what people's needs are and this is a healthcare view of people's needs. We need a whole picture, looking at the whole population of the borough, bringing those needs together, having a seamless service. I want somebody who is visiting their GP, and the GP looks at them and says, I think you need perhaps to think about do you need some care at home, that the GP is there whilst he's in that appointment, able to tap on his computer, book something online with a social worker to come in and do their assessment, and if that person, when they have a home care worker, thinks of more medical issues, that we've got a close enough relationship between that home care worker and the GP that there to be a conversation between the two about what those person's additional needs could be. Now, we're not going to get there next year, but I don't think it's unrealistic to think about us getting there by the end of the next municipal term. I think that's really what we need to be trying to work towards.
Great. Bill?
I had a question on the ethical care charter, which is now redundant because of all of what you've said. You stole my thunder. But I will say that is awesome. I mean, where we are right now with that is fantastic news. So I've got a little bit of a second question, if that's all right, and it's on the budget recovery, and that's a great effort to be where we are this year from where we were last year. I suppose my question is it possible for you to elaborate any further on the measures, or is there a plan in place to ensure that we stay within the budget and are able to make possibly further savings down the line without affecting direct services and care?
Yeah, that's a really good question. I think, that one of the pieces of work that was put in place to make sure we got this right was the budget recovery process. So this is about having a detailed plan of what savings we're going to make, how they're going to be made, identifying quarter by quarter about what savings we expect to see out of it, and then having we have a traffic light system behind that which looks at what the improvement is, and it's actually quite a rigorous process in that you start everything at red, and you can only turn it green when you know the savings is being realised. So I have a spreadsheet which still has a number of reds in it, but overall we're making enough of those savings to be able to be confident that we are over delivering those savings. There are areas that we have found it harder to make savings than anticipated, but we have also found other places which have been easier to make savings. So overall we've come out positively against the plan. But I think having the rigour of that was really important to drive things forward to begin with. But I think having that process as well has been really important in terms of that mind shift change that there has been within our staff, because they have started looking at things differently, I think, as a result of that. And I think that change in ethos has been really important. So I think there's been a real rigour to the process, which has been really helpful. I think that means that we are confident in the savings that we've identified for the budget that Council Assembly will be looking at tomorrow. But I think more importantly is because the journey we've been able to take people through the rigour of that process has actually just changed a lot of the thinking of how staff are approaching this. So yes, I can be pretty confident that the savings that we put up tomorrow are all going to be met in the forthcoming financial year. Whereas, to be honest, this time last year, given the £7.5 million overspend, I couldn't have that level of confidence.
Yeah, cool. Thank you very much.
Sonny?
No, thank you, Chair. Richard, I just want to pick up on the suicide rate, which you touched upon earlier. I think it's very interesting that the figure has improved. If I caught, or did I get it right or wrong? Anyway, my question is actually, how does it compare with other local authorities? Are we down or up? And also, if we're making some progress, how do we sustain it? And if we are not, what are we doing to make sure we make some progress?
It's a really good question. Just to quickly give you the basic situation in terms of the stats. Nationally, the figures are going up. In Southwark, they have gone up slightly. At the moment, they're quite static, but quite sticky. They're certainly not coming down. London as a whole actually has a better rate or a lower rate than the national figure. That's not true of Southwark. Southwark's probably about the fourth highest in London. So we've got quite a worryingly high rate. So the strategy that we're putting forward is aiming to get us to a place where actually we are below the London average, and that's our ambition within the strategy, is to get us to that place that is lower than the London average. Certainly, we've done a good piece of work, I think, with a number of partners about how we address this. Trying to work out what we focus on is sometimes quite hard. I mean, clearly we know some of the key risk factors. Clearly people who've got a history of self-harm, people who have a history of mental illness, are groups that are more likely to commit suicide. I think I sit in front of you as probably actually one of the key demographics, sadly, for committing suicide. It's men in their late 40s are statistically the people that in this borough certainly that are most likely to commit suicide, and a lot of those people just don't have any contact with other services, and perhaps that's part of the story and part of the problem. So we can certainly target some of the things which I think are very clear in terms of risk factors. I think we need to do a broader piece of work as well as part of the strategy, though, about some of those things which are outside of those risk factors as well. So there's going to be a lot of work, particularly on self-harm, for example, because we know that is a real leading indicator. We need to, and there's been good work, I think, in terms of some of those more public sorts of suicide. British Rail has done some really good work, for example, about training up platform guards, about spotting the signs of somebody that might be thinking about doing something, and have been quite good. And actually that has seemed to have decreased the number of people that are killing themselves on railways. I'm sorry to be overly morbid about this, about one person a year in Southwark on average that kills themselves that way. There are probably about 13 that hang themselves at home, sadly. It's that stuff that happens at home which is the really difficult thing to get a handle on. So I think the plan that we've got going forward, is a sort of 5-year strategy that's aiming to reduce suicide, is the right approach. It's a multi-agency approach, bringing all the people around the table, because we know that the voluntary sector has a huge amount to offer in this. And to touch on Helen's point earlier about what we do about talking therapies, for example, is a really important part of the picture.
Chair, can I? You said we are fourth in the
I think that's right, isn't it, Kevin? In London.
In London.
Yeah.
In London. Do we know what likely causes of suicide in the borough? Because obviously, if we're trying to find out what are the causes, and maybe we can begin to start addressing those issues. Do we have any idea?
We certainly have some idea. We certainly got a good idea nationally about the sort of factors. Now, some of those factors are less likely to play a role in Southwark than others, but we certainly know, for example, ethnicity does play a role. And we know it's more likely amongst BME communities, for example, and that clearly is a big issue for us here in Southwark in terms of our population mix. And we know that we've probably got more people percentage-wise with long-standing mental health issues than the average borough as well, and that plays in as well. But I think one of our frustrations actually, if you look at the data, is the data, for example, from the coroners, which is a really critical piece of information, we think. They're actually quite slow at giving us that data and information, and so part of the work we're going to do is looking at that and trying to get to the bottom of some of that data and having those conversations with coroners about how we can get to a better place in terms of sharing information, so we can try and identify those things early. We quite often do get to find out eventually, but it can take a number of years, and a number of years just as good enough. So part of the work is about getting better data as part of the strategy.
Thank you.
It's your turn, Leo. You're next on my list.
I don't know if I just ran out of the council back in. Fantastic to hear about the account of the extra care housing that is potentially coming forward, and
Nursing home.
the nursing home.
We have extra care housing as well.
Important distinction. I've asked this before in another forum, but not in this forum. Questions very, very dear to mine and Sunning's heart. Is there any update on that all-important Arms House? It's 57 extra care homes. It's the very best in terms of the craft workshop, the community cafe, the social rent element of it. the fact that the entire model of older people's living is attached to it. Do you have any updates on the extent to which we can?
I think the short answer, sadly, is no. Sadly, for those people that don't know, this is about the scheme that has involved United St Saviour's on Southwark Park Road to use the old nursing home site, which is just at the bottom of my road, in fact, so I see it all the time. It's a constant reminder to me as well as you that something needs to be done. But the challenge, as you know, is about, I think, sort of the financing of it all and how that money is coming forward and whether there's a way of finding a solution to it. I know that having had these discussions before, I think there's a nervousness about because I think that one of the suggestions you were trying to see is if we could find some forward funding for this that could then get recompensed later on by the Landseahood, a developer that are helping fund this. And the difficulty is that feels to Regen, in the conversation I've had with them, it really lies with them, a bit like letting Delancey a little bit off the hook. And so that's been the challenge there, really. So I'm afraid I haven't got any positive news up here.
Fair enough.
David?
Thanks, Chair. A couple of questions. I see, thanks to Julia, we've got your full description of your responsibilities, which includes, I see, a Southwark and age-friendly borough. And I just wanted to pick up on how we're doing on that. So, because when I'm thinking about some of the casework I've had recently, I've had a number of residents who've contacted me, and older residents, about their inability to actually take up services at the council because of our sort of the way the move to digitalisation. So things like, for example, the bulk refuge collections, you can only order a bulk refuge collection online. Parking meters obviously increasingly you have to pay with your card. Obviously we've been to some extent understandably closing offices and requiring people to sort of push one for housing and two for thing. And all of these things, including actually one about council tax as well, someone who's struggling to pay their council tax, not being given very many options to pay it. I mean, what do you think? Do you think we're doing very well on being an age-friendly borough? Because I think a number of our older residents are feeling excluded from our services. I mean, I understand the driver, because obviously we need to, it saves money, bluntly, for the council to provide services online, but do you think we're leaving behind a whole section of our older community that just aren't able to access things and don't have computers online?
I certainly hope not. And we're going to take forward a sort of update report soon on the age-friendly borough. It's certainly not something we've lost. It's not, I know we've had discussions before about what the accreditation from the World Health Organisation means, but for us actually, again, it's not just about ticking a box, it's about changing the way we look at issues as a council as a whole. I think this is a journey. We are certainly not fantastic in everything yet. I understand the issues that you're raising, and certainly as a councillor, I sometimes have some of those issues as well. I think some of those things about getting those services right, we need to do more work on. I think clearly. There is also, though, we oughtn't to, where people do have the capacity to do things online, I don't think we should be discouraging that either, though. And actually, there's lots of other benefits besides being able to contact the council that people can get if they're digitally included. So I think the work that we're doing in terms of digital inclusion to try to address those issues, I think is really important, because I think there's benefits besides just dealing with the council through that. I accept certainly there's some things where it's always going to be more difficult for some people to access. So I think we probably need to look again at some of this, and I think that's part of the work we'll be doing through sort of reviewing the age-friendly process. It's an interesting observation that you make about channel shift meters and paying bills and things. I'm sure there won't be any proposals coming forward at Council Assembly tomorrow, for example, that all council tax should be paid by direct debit, because obviously that might exclude some people. If there's any ideas like that come forward tomorrow, I'm sure council notes that you'll be voting against them.
don't be too sure of that. I have to look at the whole package. I'm doing the one? Yeah. So on the financial budgets, obviously it's good that the turnaround that's been achieved, but obviously, you know, I'm sure we're not out of the woods yet, in the sense of there's probably more challenges to come on the financial front. I mean, do you think what do you think this is having? What impact is this having on the quality of our services? Do you think, I mean, the sort of cuts that are being made in adult social services and the budgets, do you think that's starting to impact on the quality of the service that we actually offer? I mean, obviously we're not able to have such a big offer because, bluntly, we're having to put our resources into those who most need them. But do you think there's a negative consequence now that's being felt among those people who are receiving adult social services?
I'm certainly not seeing it at the moment. I think some of the changes there have probably particularly been around who's eligible. We've had a conversation before about the impacts of the Care Act, but clearly some of the work that's been done has been around assessments, and that has had an impact in terms of what services sometimes people receive. I think sometimes we find that when we go through those assessments there's been a huge amount of duplication, so actually just squeezing out some of the duplication has been really helpful in terms of process, and I think we all see that as a good thing. I think clearly as well there's been more work to be done to ensure that where people ought to be making a contribution towards the cost of their care, they are doing that. I think those are probably the things which have really been, in terms of service delivery, which have been most clear in terms of their impact, in terms of the fact that some people are paying more and the fact that some people are no longer eligible for things. I don't think we're seeing any impact really in terms of the quality of service, because what we're not doing by and large is breaking down the rates that we pay people. And indeed, the ethical care charter has been precisely the reverse, although interestingly the increase that we have actually seen in terms of rates has been less than perhaps we anticipated to begin with.
In regards to sort of satisfaction surveys, though, for the service users, I mean, I'm not sure what level of satisfaction surveys we do in relation to services, but I mean, are you able to say any more? I mean, you don't think there's been any decline in
it's, well, I talked about, obviously, other than the ethical care charter, which I talked about earlier, in terms of the sort of services for longer term service users, which is something that we track, it's stayed pretty level, if I'm being honest. It's not necessarily ticked up, but it's not come down either. So it's pretty much stayed on trend. We're not seeing any real data come through. Now clearly, we know from our conversation about Queen's Road there have been some service changes which have been quite disruptive and created some issues for people. I'm not going to get away from that. But I think overall, looking at all the performance stats, we're not seeing a decline in people's satisfaction.
I suppose my only sort of worry about you saying that, although it's welcome in many ways, is that doesn't it just give comfort to the government that they can keep on cutting? That actually, if we can keep doing it better on less money, when the government just take that as a green light to carry on cutting our budgets?
I mean,
there must be some negative consequences.
The last year has clearly seen government realise that cuts to social care have an impact on things beyond social care, and particularly on the health service. And that's why we've got improved better care fund, and I think that has helped us get to a place where at least government is giving us that money. And that, again, I talked about the recovery process, but the money we've had from the improved better care fund has been helpful as well in terms of getting us to a better place and more sustainable place. Clearly we found it harder to in some of the areas like children's, for example, to make those savings because there's less room for manoeuvre. But we have. I think the fact that the system as a whole nationally appears to have been buckling, and that's why improved better care fund was put in place to try to address that, shows that just because we are doing things well and arguably better than some other authorities that have had similar challenges, I don't think detracts from the fact that there clearly are very big pressures. And over time, we know from our demographic profile that the risk is that these challenges become greater as time goes on, and again that's some of the work that we're looking at the moment in terms of future needs.
Just one point of clarification. This is just on the suicide rate. Maybe I missed it, but obviously I think originally in the strategy was a reduction of either, was it 5 or 10% over 5 years or something? Yeah. Have we now amended that to, in some way, to try and bring us below the London average?
The wording that we now have is our vision is to reduce suicide, attempted suicide and self-harm in Southwark to among the lowest rates in London. To work towards this ambition, we've set a local target to reduce the number of suicides across the borough by at least 10% over the 5 years of the strategy. So that won't necessarily deliver.
That won't necessarily deliver us being lower than.
If we would
hit the target, isn't that? It's
a
ambition.
Longer-term ambition is to get us below that average in 5 years, to get us to at least 10% lower than we are at the moment. So we're working towards getting us below the London average. We might not get there in 5 years, but we'll put in place the work which will see us on the trajectory to do that. And our barest minimum benchmark is that we're reducing it by at least 10%.
To be fair, it would be fair to describe it. So we have our ambition is to get lower than the London average, but our target is to a minimum of 10% reduction. Which may or may not get us.
Which is a development from where we were at the Health and Wellbeing Board when we looked at this, because then it was looking at reduced by 10%, and that was kind of it. We recognised that we need to have that bigger ambition.
It's good to have ambition.
Yeah, it is.
Okay. Finally, Helen.
Oh, thank you. Quick one on the mental health strategy. Could you just update us on the timetable for delivering on the action plan linked to that?
I probably can't do that yet, because a lot of that work is still ongoing. I mean, the strategy put in place quite a large number of actions, and the strategy also sets out that effectively each of those actions has an action plan, and the work now is to develop that action plan and to put them in place. Now, given the large number of actions there, we're going to prioritise. So the priorities are going to be about mapping the offer that we have in line with the feedback we've got from the community around during the development of the strategy, looking at perinatal services, the review of the CAMS service, and I know that children's adults have been in discussion with SLAM about that only today to try and look at a way forward, and we're making some good progress now, I understand. Crisis pathway improvements is something else that we're looking at, I think particularly looking at issues around places of safety, looking at some of the issues around also around forensic housing, so housing that's particularly associated with ex-offenders whose previous offences have been linked to their illness. We've got some interesting models we think in Canada that we can learn on, sort of look at that as a model to take that forward. I think developing antisocial behaviour initiatives in partnership with SLAM and council services and other agencies such as the police, and mental health offer for homelessness services, and finally employment support. So those 8 areas are going to be the areas that we concentrate on first. So I don't have a timetable yet, given strategy was only agreed back at the back end of January, so less than a month ago. It's a little early to have all of that pinned down. Certainly I think it's really important this committee gets an update on those plans as they develop, and I'll undertake to ensure that that happens and you get that. But those are going to be the areas we'll be looking at first.
Yes, I mean, one other one, and you'll know from conversations that we've had that one of the things that I'm concerned about is how we're supporting people who aren't meeting thresholds for statutory services, and what we can do more broadly. And some of the other parts of your agenda kind of do touch on that, particularly around older people. And there's been quite a lot in the news, I suppose, about loneliness and social isolation, and you know, if you're somebody who is pretty much on their own, you might have some care needs, but you might not necessarily meet the requirements for provision through the Care Act. But you know, how do we, as a council, how do we know about those people, I suppose, and what more can we do? And it's probably about your portfolio also joining up with like Councillor Anderson's portfolio and others. But what can the council be doing maybe to address those needs within our population and the people who kind of fall under statutory minimum threshold?
Well, I think the really important thing is that whilst people fall below statutory minimums, that there are still services or facilities there for those people which help them. I think there's first two strands in the mental health strategy. The first one being very much about prevention. How do you ensure that people have a level of mental health well-being which stops them getting to a place of mental health crisis? I think is really critical, and it's a really important strand of the work. And yeah, it's the reason we put it first, is because we think that first and foremost is the area where we need to do most work to develop. And the second strand being looking at very much about what we do in the community and that community-based approach. Again, I think ties in very strongly with that. So I think there's work that needs to be developed on that. You're absolutely right. You know, I think the push of this strategy is very much about trying to address issues upstream, and therefore effectively finding ways that we can deal at volume in lower level, low intensity ways with people before illness can develop, and that we're treating it in that sort of way, and that's very much the mindset of the strategy. And so again, I think we'll have to see how some of this develops and works its way through, but it's very much about the thinking of this is trying to address those issues.
Okay, wonderful. Thank you. I think that's all of our questions.
Thank you very much.
Thank you, Richard.